Alright, today's notes we're going to take a look at the major skeletal muscles. In particular, we're going to look at the superficial muscles that are going to be on that of the human being. And taking a look, we're going to just go on the left-hand side going down of each of the individual types of muscles. And what I'm going to do is the best I can to kind of cancel out the ones that you will not be labeling. This is going to be one of your diagrams that you're going to start seeing on your test. Now, so on the left-hand side, we work our way down. Frontalis is going to be one of those muscles that's going to actually help raise and lower your eyebrows. That one is going to be right off the frontal bone, hence why the term is frontalis. Orbicularis oculi is circles around the eye, so it's going to help you open and close that of your eyelid. Zygomaticus is actually connected to your zygomatic muscle and is your smiler. Trapezius, on the left hand side, continue going down, is one that's going to help you elevate and depress your shoulders, which you learned in the skeletal system. Serratus anterior, we're actually going to cross this one out, so this one we will not have to worry about. Okay, so we'll cross off serratus anterior. External oblique, we will. That is kind of what we call our love handles, or our sides. Rectus abdominis are our typical six-pack muscles. Tensor fasciae latae, we will be actually labeling this on the cat. We will not be worrying about labeling it here. Sounds like a fancy coffee drink. You can get at Caribou, but this latte is something that's we're gonna have to worry about right now. The sartorius is the next muscle. This is a muscle that actually attaches the lateral side of the hip. So it's way over here, and let's actually zoom in quick so you can see it. So if I zoom in, it attaches at this point here and works its way down anteriorly to the most medial end of the proximal portion of the tibia. So it actually wraps itself around the front end of the leg, one of the longest, if not the longest muscle in the body. From there you get to the prime mover of the quad, known as the rectus femoris on the femur. Adductor longus is one we can cancel out. We're not going to have to worry about the adductor longus muscle. So you can cross that one out. Vastus lateralis we will. That is one of the other muscles that is on the quadricep. Now lateral meaning outside, so it is the muscle that's on the outermost side. Fibularis longus, you could probably estimate where it's at, located on the fibula. It helps you elongate up that, but we're going to cross that one out as well. Tibialis anterior, we should know, that is in the front of the tibia. In front of the tibia, that's the one that's going to help us give us shin splints. And we will cross off this last one, this extensor digitorum longus. So the ones that you will have to worry about right there: frontalis, orbicularis oculi, zygomaticus, trapezius, external oblique, rectus abdominis, sartorius, rectus femoris, vastus lateralis, and tibialis anterior. On the right hand side going down, you have the masseter. The masseter is going to help you raise and lower your mandible. It's attached to the zygomatic arch. It is going to allow you to chew. Orbicularis oris is actually going to be circles around the mouth, helps you pucker your lips. The sternocleidomastoid connect to the sternum, the cladoid process, or the clavicle, and the mastoid process behind that of the mandible. It allows you to turn your head left and right with that pivot joint of the atlas and axis. Deltoid is the point of the shoulder. It's going to help allow us to abduct that of the arm. Pectoralis major, the most superficial muscle. We have a minor, but that's deep within there as well. It's found on the pectoral region of the body. The biceps brachii, one of the common muscles that we do know, we just call it a lot of times just the bicep, but it being that's on the upper arm region, we call it the brachial region, we call it the brachii. Brachialis we will ignore for the time being. Brachioradialis as well. Okay. Gracilis is also known as your groin muscle. Gracilis is going to be connected to the pubic bone, wrapped around down to the medial portion of the tibia as well. Vastus medialis, it is a vastus muscle just like on the left hand side of the vastus lateralis, but however it's going to be in the midline of the body, so that's another one you know. And the last two you will also know: gastrocnemius and soleus. Gastrocnemius is your calf, soleus is that of the side of the lower leg. So if we take a look at what they are, breaking our way down, we also have a backside. Now, temporalis we will ignore. We should be able to do occipitalis in the back of the head. Sternocleidomastoid you can also do. However, I believe on the test I also get rid of occipitalis, so you can kind of cross out now too. Deltoid you will do. The teres major and minor we will cross out. Triceps you should do. The biceps femoris is also known as your hamstring, so you'll do that one. We'll cross those out. Gastrocnemius you should do. We already mentioned the calcaneal or Achilles tendon in class, but we're just going to label the gastrocnemius. The trapezius you should be able to get the, let's go all the way down to the latissimus dorsi is the next one. External oblique, medius and maximus, abductor longus you will not need to do. The adductor magnus. We'll skip the sartorius there. And the fibularis longus. So there are your muscles that you're going to be looking at. Now, as we go through, if we work our way down into muscles, we have to identify first off that every one of these muscles, in fact, 644 muscles in all in the skeletal muscle system, all of them have inserted at least in two different spots. One of them is known as a spot of insertion, and that is a point in which the muscle actually moves. The other is a spot of origin, the spot that it does not move, where you think of it originating from. Now, whenever a muscle does go through its contracted state, it is going to shorten, and as it shortens, it pulls towards the point of origin. So if you think of your bicep, when you flex your bicep, your lower arm, your antebrachial region, will pull up. What that means is that the insertion point is going to be on that of the radius, and so when you contract that muscle, it pulls towards the acromion process. It pulls up, making your lower arm raise up. A couple other things that you're going to start to see are the terms. One of them is called a prime mover. A prime mover is, think of it as the largest of them. If we have to do a large workload of things, it is going to be doing the most of the work, the heavy lifting. If we go to your quadricep muscles, you have four muscles that are going to make up the quad. Those four are the vastus muscles, vastus medialis, intermediate lateralis, as well as the rectus femoris. But the rectus femoris sits on top and actually is the largest of all of those. That one will do the majority of the work. That one is known as the prime mover. Below that, it talks about two different terms, synergists and antagonists. Synergists are muscles that are actually there to help out. So as I go back to my quadricep example, the four muscles working together to pull the muscles in the same direction, which is extend that of the lower leg, are all working together, so those are working in synergy, synergists. Now, those that oppose you are antagonists. So if my quadricep muscle is used to extend the leg, I have an opposing muscle that is used to flex the leg. That would be my biceps femoris, my hamstring. A lot of times we also have the other examples, the bicep versus the tricep for antagonistic. Now, if I was going to look at the muscles that you need to identify, here is what they are in writing. Of the face, the frontalis is the muscle that's going to lift out your eyebrows. The orbicularis oris is going to help move your lips. Zygomaticus is your smiler. Orbicularis oculi moves your skin around the eyes, and the masseter helps you chew and or speak. Neck, working your way down, turn your head left and right, was your sternocleidomastoid, which is allowing to move that pivot joint and the atlas and axis. Here's an image of those. You will not be labeling any of these muscle images on your test, so you don't have to worry. But you are able to see how that masseter, for example, is attached to that of the zygomatic process and then inserted then onto the mandible. So when that contracts, it brings that jaw up. Now looking into the trunk, your trapezius, raise and elevate your shoulder, pectoralis major and minor, they're to adduct the muscles to your arm. We're actually not going to worry about serratus anterior at this point, so you can skip past that. Intercostal muscles, this one is in between your costal cartilage. You think of that as where your ribs are. These are actually the muscles when you have your ribs for dinner. This is your baby back ribs or whatever you might like to eat. These are the muscles that are going to be within inside that of your rib cage that helps you breathe and remove air from your lungs. Your rectus abdominis is your six-pack muscles, your external obliques, your love handles, and then again your latissimus dorsi helps you. It's the larger back muscle, the most superior region of your back. So taking a look at that, if I was to actually remove, when this image here shows you the removal of the pectoralis muscle, which is over on this side, I removed it so deep within you actually see the minor. And then you see some of the serratus muscles as well as the intercostal muscles in between. The six-pack muscles, we all have that. This over here on the right-hand side you can see is called the linea alba. That is the band of connective tissue, the white line that's going to go up and down. You will be labeling that in the cat dissection. but it's the white line that separates out the right and the left hand side in a sagittal cross-section type plane. Upper extremities, the three you need to know are deltoid, the tricep, and the bicep. Lower leg, you have your butt, your gluteus maximus, and your hip, your gluteus medius. And then you have your upper thigh muscles. Now, the thigh muscles, not only you're going to have your quad, and the quad are these four here, the vastus muscles as well as the rectus femoris, but you also have two other muscles that we're going to refer to in the front side, and that is your groin as well as your sartorius, which wraps around as one of the abductor muscles. Your biceps femoris, that is your hamstring. Work your way down a little bit lower. Then the lower extremities, you have your tibialis anterior, which is in front of your tibia. It's the one that causes your shin splints. The side of the lower leg is your soleus. And then you have your calf, which is your gastrocnemius. Here's an illustration of those. Now on this side over here, you see that the muscle, the prime mover on the top, which is the rectus femoris, was removed. So now at least you can see the vastus intermediate. The other ones, you can see the vastus lateralis on the outside of the leg and the medialis on the inside of the leg. Showing your IT band, and then you have your other little section here. You're going to label actually on the cat, the tensor fasciae latae. But your sartorius is attached at the ilium, wraps around anteriorly, the most proximal end of the medial portion of that of the tibia. The rectus femoris, again, is a prime mover that's on the top, vastus lateralis on the side. And there you can see your hamstring, your biceps femoris. The two you're going to be labeling here are the gluteus medius and the gluteus maximus. Medius is your hip, maximus is your butt. We will actually not label the minimus due to the fact that it's deep. We're only going to be labeling the superficial muscles. Lower leg shows you that your tibialis anterior, which is in the very front of your leg, your soleus, which is the side of the lower leg, and then you have your gastrocnemius, which is your calf. So you can see the same type of thing on either side. You have your soleus of your lower leg, and then you have your calf muscles. In our next set of notes, we're going to talk a little bit about oxygen debt and how our bodies start to shut down due to, or at least our muscles start to shut down due to the lack of oxygen.